This is the what we call hands-off approach or direct to consumer, which means you let them order it. This is especially helpful if you're a non-primary care practitioner and you don't want to order the labs or be involved in that, right? Because remember, if you're a registered nurse or a pharmacist or let's say a physical therapist or an acupuncturist or a chiropractor, you might not want to order those labs. You might want to let the patient to order those labs, because now, one, you're saving time on an administrative task, and second, you're not involved in the process of ordering the labs. So you're there to educate the patient, to provide health consultations to the patient, right? You're not there to diagnose diseases, right? You're there to just provide patient education. So where would patients order the labs for themselves? Well, you got multiple services now available. For patients, you have Genova Connect, you have healthlabs.com, Ultralab Tests, LabCorp On Demand. Patients can now order labs directly from LabCorp. They don't need a practitioner to do that. They do need your guidance to understand which labs would be more recommended for them. And second, when they get the results, they need somebody to educate them about what the results means, right? Again, we're not talking about giving them a diagnosis. We're talking about really just educating them about what this looks like and what does it mean. And then life extension is another one. All right, setting up your professional grade supplements. So here's a list for you of the professional grade supplements. So on top, those are the supplements you can see that have professional grade. So where it says professional grade and herbal medicine, those two categories, those are companies that have the GMP certification, which is good manufacturing practices. The reason we're giving you this resource is because we don't want patients to order their supplements from Amazon or off the shelf. Now, I'm gonna generalize with what I'm saying. There are good brands on Amazon. There are good brands in some of those stores, natural food stores, right? The problem is that the FDA does not regulate supplements in the same way it regulates medication. With most companies, they don't test to verify that there's no contaminants in the supplement. There's also reports, you can read them online. If you Google New York found supplements that did not have in the capsules what they were supposed to have in the label, right? So there's actually several articles that were published on that where they took supplements from different big chains, I'm not gonna mention the names, but big chains, and they bought those supplements like ginseng or vitamins or whatever it is. They send it anonymously to a lab testing, and what they found is majority of those supplements did not contain in the capsule what they said they should have on the label, right? So patients are buying curcumin or ginseng or certain supplement. They're thinking they're getting the real thing. In reality, they're getting mostly just fillers. So this is where it's really important to guide our patients to buy professional grade supplements that have third-party testing, that has the GMP certification, right? Those are all really important from a reliable source of information. If you buy a supplement from a company, you don't know what's in there, they never tested it, you don't know, it could do more harm than good, right? So that's where we have to make sure that we provide that guidance. If patients do want to have something that is more affordable and they absolutely just want to order it from Amazon, then Garden of Life, Life Extension, Now, and Nature's Way have better reputation and they've been around for years, and those are the more affordable supplements. Now, if you want to have access for professional grade supplements for your patients at a more discounted rate, then you can set up a Fullscript account, which allows you to create a page for yourself, and then you have a designated page for your patients to order those labs. You can, they give you a preferred rate and ability to choose from 10 to 40% profit, or give that 10 to 40% as an additional discount to your patients. Now, if you want to purchase supplements for a brick and mortar practice to just have it on the shelf for patients to buy, then go to Emerson Ecologic and establish a practitioner account, and you can find professional grade supplements there. and those will be shipped to you. You can also ship them directly to patients if you need to. Now, what I would recommend is to review the lab results before you meet with your patients, to write down treatment plans. So especially in the first few times when you do these, or if you got a complex patient, right? What we typically do in the academy as part of your functional and nutritional medicine certification process, you actually get sessions, coaching sessions, one-on-one for case review with a mentor. And our mentors are functional medicine physicians who have over a decade experience with teaching and doing functional medicine and running practices. So you get on one-on-one with them and you start doing case studies. You can take yourself as a case study. That's what I did. I also took my father as a case study, and I learned so much by doing that, right? By having a very experienced functional medicine physician going over the case with me to tell me, okay, oh, notice this, or maybe we should do that, or maybe this would be appropriate, or maybe this could save you time or save the patient money, right? So it's an amazing process that I would recommend each one of you to do. And when you are in the program, just go into the platform, the Advanced Functional and Nutritional Medicine Certification platform, and on the side you will see book your coaching call with a mentor. It doesn't cost you anything. It's all a part of your program, and you get 2 years of that, right? 2 years of that. So we got practitioners scheduling every month. They're scheduling a coaching call to help them grow their practice or do a case study review before the patient comes in for their report of finding. Right? So this is really useful, but I would recommend sit down with yourself when you get the evaluation form and the lab results and just highlight what are the 2 to 4 things that I can do for my patient right now. 1 dietary change, 1 lifestyle change, and maybe 2 or 3 supplements, right? Don't overwhelm them. Just give them the basics to start with for the next 2 months or 3 months, right?